On the occasion of the World Cancer Day, we have certain important messages and advice to be followed that will help in the cancer prevention at large, also acquiring the proper treatment. In the current day situation, the incidence of cancer is slowly increasing. As with the diverse culture, languages and practices in various parts of our one India, well, the pattern of cancer also differs. That's why treatment planning in one area cannot be applied to all areas uniformly. For example, see, in the northeast, you have liver and gallbladder cancers, the stomach cancers, lung cancers. They are much more. And also your food pipe cancer, what you call as esophageal cancer, they are also more in this, more incidents are prevalent. They are more prevalent in this part of our country. Well, the treatment of cancer, well, there are different, spheres. It is always a multidisciplinary or multi-modality treatment comprising of the surgeons, the medical oncologists, the radiation oncologists, recently the palliative care physicians as well. So that the patients, even though more than about 60 to 70% of the cancers are curable if detected in an early stage. So beyond that the scope will be less when you come across cancers in a very advanced stage. They are not curable. Well, they will compromise the quality of the life and the productivity of the population in general. That will be reflected on the productivity of the country as well. So that's the reason why we have the palliative care. Even though they have cancers, well, they live with the cancers. Even though if it is an advanced cancer, nobody need to fear. It is not going to grossly alter the longevity, but then whatever time that we live, we need to live a quality life, or what we call a painless, a comfortable life living with cancer. That is one aspect. And all that I need to share with our colleagues and the fellow men, our people, is that early detection and prevention are of paramount importance in the management of cancer in our country with a large population like ours. All right, how do we do that? Well, changing lifestyles. And more than about 50% of our cancers are tobacco related. So tobacco is not a product that cannot be eliminated. It is not an article that cannot be avoided for living or live without it. No. So most important thing is you must avoid the tobacco in any form for that matter. I would also add, not that you yourself, that particular individual uses the tobacco product, like your cigarette for that matter, even if they are smoking in a group, in the community, the people around are also liable to get cancers in equal numbers, so that we must realize. So it's very important to, give up or have cessation of use of tobacco products, especially the tobacco smoking, or tobacco in any form for that matter, tobacco chewing, pans, etc. They should be totally avoided, my dear countrymen. And the other one is environmental pollution. The exposure to the cancer producing agents. It could be physical agent or a chemical agent or whatever. So the state or the governments and the other private organizations, they are having their own industrial health policy and industrial health promotion policy to give protection against toxic chemicals and other agents which are responsible for causing cancer. That is one thing. As far as the lifestyle of individuals are concerned, like exercise is very important, and food, and excessive carbohydrate, excessive fat to be avoided. More fresh fruits and fresh vegetables are encouraged, should be encouraged in our regular dietary meal, and proper relaxation in terms of yoga or sharing your stress and diffusing your stress with others is also important. And there are certain other factors. Like basically, if you look into the cancers, there is a genetic modification of the genes, especially the oncogenes or cancer-producing genes. Now, if you browse it, the latest situation will be like, how do we change it? Because it's not by just changing the lifestyle, etc. It is some kind of a genetic engineering that is happening. So the genes will be modified by certain techniques. That's in the offering, and then we still have to go little distance about achieving it. So gentlemen, never shy away from with the early signs of cancers. Like when you have a chronic cough which is not relieved by the routine medications, and any kind of an ulcer or a sore that doesn't heal with conventional medications, abnormal discharges, either it is a mucus discharge or a bloody discharge in the cervix, or you call it the genital passages, is also an indication. Change in the bowel habits, like you may get diarrhea or a constipation alternating, all that could be an early signs of bowel cancer. And difficulty in swallowing, and hoarseness of voice, develop change in the voice, all of them should prompt you towards seeking medical attention, because that may be cancer. And more importantly, a chronic cough which is not abating or that is not controlled by conventional medication should also alarm you for a lung cancer or a throat cancer, whatever. So with this brief what shall I say, interaction, let me conclude and wish you all well for a cancer-free India. Thank you.